This is David Wallace with PV Reporter, and today we're sitting down with Dr. John Mascarenhas, who's Associate Professor of Medicine, Hematology, and Oncology at Mount Sinai. Good to see you.
Nice to be here.
2015 in Orlando here this year.
Yep.
Wanted to just hit you with some quick questions. If you could give me kind of an update on some of the latest clinical trials in the MPN world, that'd be great.
Sure. So there's still a lot being done in terms of clinical trials for myelofibrosis. There's, for example, at ASH this year, there's been updates on the long-term follow-up of patients enrolled in the COMFORT studies, particularly COMFORT 2, with some reports of reduction in bone marrow fibrosis in select groups of patients with long-term administration of ruxolitinib. I think importantly, the studies have also shown there hasn't been an increase in unexpected toxicities such as myelosuppression, and that at least at 3-year follow-up, about 50% of patients have remained on study drug. Additionally, recent reports have shown that there continues to be what appears to be a survival benefit to patients who've been randomized up front to ruxolitinib compared to patients who were on the opposing arm and then crossed over, which suggests that the drug has some activity that is probably mostly mediated by improvement in symptom and spleen response and reversal of cachexia, but sort of fortifies the fact that it's an effective drug in the setting. I think still more needs to be done, and that's the reason why we continue to do clinical trials and evaluate new compounds or combinations of drugs with ruxolitinib, but there's still a lot of interest in addressing the disease at the stem cell level. To that effect, the results of the imetelstat pilot study by Dr. Teferi have gained a lot of interest. There were responses in that study that were of significant interest, including complete responses accompanied by molecular complete responses and regression in bone marrow fibrosis. So there's a drug that appears to have some activity at the level of the stem cell. There'll be a lot of interest to see results from the multicenter phase 2 study sponsored by Janssen of that drug given in patients with advanced myelofibrosis. Another drug that's gained a lot of attention is an antifibrotic drug called PRM151. That's an infusional drug given every 4 weeks. That's a pentraxin 2 analog. It's a very interesting compound that has, at least in the stage 1 part of the phase 2, stage 2 design, has shown some reduction in bone marrow fibrosis and improvement in cytopenias. The extent of that, I think, will be explored in the larger stage 2 part. So that's an exciting trial that continues to progress and will continue to enroll patients. And then there are a significant number of, I think, well-positioned and well-thought-out studies of combination therapy, agents like panobinostat with ruxolitinib, LDE-225 with ruxolitinib, PI3 kinase inhibitors with ruxolitinib. And many of these studies have preclinical rationale that support its clinical evaluation and are continuing to be evaluated. Of course, it's a slow process. Patients always want to know if there's any new news, and sometimes there is, and often it's a continued process that doesn't always generate updates, at every meeting. So, there were no, unfortunately, I don't think there were any significant updates at this meeting that were blockbuster, but the work continues, so it's an ongoing process.
Okay. I think you hit most of the highlights as far as the clinical updates. I'm going to ask you a question or two, just kind of off the cuff.
Okay.
On CRNT website, Dr. Silver has an area where he talks about reduced blood flow to the brain. And I wonder, as a PV patient, is it possible that in further years that patients may have susceptibility to forms of dementia because of this?
Yeah, that's a great question. I don't know the answer to that question. I mean, we definitely know that patients with polycythemia vera and essential thrombocythemia and MPNs in general are at risk for thrombotic complications, microvascular and macrovascular. How that affects the cerebral circulation and the clinical impact of that, I don't think is known at all. So that's an interesting thought and definitely an interesting discussion. I mean, ideally it would be studied formally, but what effects having these hematologic diseases could have on brain function and dementia, to me that's a totally unexplored area. So that's a very interesting thought. I don't know much more than that.
Okay, that's fair enough. And I'll end on one of the new things I heard talked about yesterday. We hear all the usual suspects of pruritus and fatigue and the general symptoms, but I hadn't heard much talk on intimacy until yesterday.
Right. So there was a talk actually at our education symposium by Deep Duradia from Guy's and St. Thomas in London about the symptom burden of polycythemia vera. This has gained in a lot of attention over the years, mainly driven by Ruben Mesa, who gets a lot of the credit for exploring this area that I think was neglected previously. Probably neglected because we couldn't really do anything about it. Now there are therapies that have clearly shown to have an impact on symptom burden, and at least evaluating symptom burden is important. An area that probably is neglected more than anything is probably intimacy. I mean, I'm for sure a culprit in not normally addressing that at visits. It's a difficult topic, and it's not always covered. But it's definitely an area that is an issue for patients, PV, ET, and other patients. I think I give Dr. Roddy a lot of credit actually for bringing that up, and I think it's an important area. It shouldn't be neglected, and I think it should be addressed.
Right, and I hope as we move forward that we start looking at some of the topics that haven't been discussed in detail, and those are just a couple that I have an interest in seeing further exploration.
I would agree.
So, Dr. Mascarenhas, I want to thank you for sitting down with us at ASH 2015 here, and this has been David Wallace reporting for PV Reporter.
My pleasure. Thanks very much.
Thank you.
Bye.